scrutiny committees. I just want to make all of you aware that today's meeting will be recorded. Can I also welcome members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? So before I get into the logistics of the meeting, as a reminder, Cabinet scrutiny will immediately follow this meeting and Cabinet immediately follow that. When this meeting is ended, you will need to exit this meeting to enable you to join the next meeting. In addition, can I refer you to the protocols for remote meetings, which have been previously circulated, namely all mobile phones to be switched to silent. Your microphones should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams. When using the chat function, can you please make it clear that you wish to ask a question and not just provide a comment? Also, when asking a question, can you please indicate which page number you were referring to? When speaking, please introduce yourself. I will now do a roll call of attendance. So, Councillor Charlotte Goldsworthy.
Here.
Councillor Mike Harvey.
Yeah, here.
Councillor Lynette Purcell.
Present.
Councillor Steve Harmon.
Present.
Councillor Arthur Davis.
Present.
Councillor Nicola Davis. No. Councillor Oliver Davis. Councillor Carolyn Edwards.
Present.
Councillor Wyndham Griffiths.
Present.
Councillor Helen Clark. Oh, I've had her apologies. Councillor John Miller. Councillor John Miller. Councillor.
Present.
Thank you. I've had apologies from Councillor Suzanne Patterson. Councillor Sonia Reynolds.
Present.
Councillor Dave Whitelock.
Present.
Councillor Del Morgan.
Present.
Councillor Sheila Penry. Councillor Sheila Penry. Councillor Nigel Hunt.
Yeah, you can see Nigel Hunt in the chat saying he's present.
Okay.
Yeah.
Councillor Alan Llewellyn.
I'm present. Thanks.
Councillor Sharon Freegard.
Present.
I've recently had apologies from Rydian Eisen. Councillor Simon Noyle.
Yes, yeah.
Yeah. Councillor Arwyn Woolcock.
Yeah, present, Chair.
Yeah. I just had indication as well that Councillor Penry is in the meeting. Councillor Sandra Miller.
Present.
Yeah. Councillor Rob Jones.
Yes, present.
Councillor Carol Clement Williams.
Present.
Councillor Doreen Jones.
Present.
Councillor Edward Latham.
Present.
Councillor Alan Lockyer.
Present.
Councillor Peter Rees.
Present.
Councillor Peter Richards. Councillor Annette Wingrave.
Present.
Councillor Leanne Jones.
Present.
Thank you. And then if I move on to officers, so Jack Straw.
Charlotte, can I stop you there?
Yeah.
You haven't asked if I'm here.
Councillor Hunt, I'm very sorry. I'll mark you down as present, sorry. There we are. If I carry on then, Jack Straw.
Present.
Thank you. Councillor Stephen Phillips.
Present, but not a councillor.
Oh, sorry. Sorry. Just because
Wouldn't
it's
have you?
name.
Yeah.
Aled Evans. Andrew Jarrett.
Yeah, present, Charlotte.
I've had apologies from Nicola Pierce. Howell Jenkins.
Present.
Karen Jones.
Present.
I've had apologies from Hugh Jones. Craig Griffiths.
Present.
Angela Thomas.
Present.
Chris Frey Davis.
Present.
Spencer Blewett.
Present.
Alex Hardin. Stacey Curran.
Present.
Chloe Plowman.
Present.
Tammy Davis.
Present.
Annette Manchip. No, I've got apologies from her. Karen Thurlow. No. If I've missed anyone at all, can you please indicate now?
Can I just say, Councillor Oliver Davis emailed me to give his apologies.
There we are. Thank you for that, Councillor Purcell. We'll mark him down.
Yeah, and Charlotte, Councillor Sheila Penry is in the meeting. It's on the chat as well, and you've seen
Yeah.
her.
Yeah, that's fine. Thank you. So if I take you back to the agenda, the first.
Charlotte, sorry, Dave Griffiths present as well.
There we are. Thank you, Dave. Right. I think that's everyone. There we are. If I can take you back to the agenda, the first item today is to appoint a chairperson and vice chairperson. Can I please have a nomination for a chairperson?
Yeah, I nominate Councillor Lynette Purcell as chair.
Thank you. Can I have a seconder for that?
I second.
Thank you. Councillor Purcell, can you take your seat as chair?
Thank you. Can I please have a nomination for the vice chairperson? Can I nominate Councillor Mike Harvey, please? And can I have a seconder?
I second, Chair.
Right. Okay, so we move on to the agenda. And the first item is declarations of interest. Do we have anybody to declare any interests at all, please? Could you please indicate? I see none. Thank you very much. Right. We are now ready to move on to agenda item 3, the overview of the regional response to COVID focused on care homes. Can I invite Andrew Jarrett, please, to make an introduction? And before he begins, could I ask him to include in that introduction on item 1.1, the Extraordinary Regional Partnership Board is identified as having commissioned the report. Could he then please explain at 2.2, where it says the partnership wanted assurance that the West Glamorgan partnership was doing it right? In order to clarify this for people who are not members of the Social Care, Health and Wellbeing Committee and members of the public and the press, could he clarify this and explain the different composition of and areas of responsibility of the component parts of the board? Thank you. Take it away, Andrew Jarrett. Thank you.
Thank you very much, Chair. Just wanted to give a bit of context really before I allow Jack to come in around his report. So we've been through some really extraordinary times. COVID-19 has changed our lives significantly since the first case came to England at the end of January, and the first case in Wales, in this region actually, was found on the 28th of February. Our vocabulary has changed, and words such as isolation, shielding, quarantine, and lockdown are now a regular part of our conversations and have particular meanings that all understand. We've been made to stay in our homes whilst our economic and leisure infrastructures have been shut down as a result of the virus. And the virus that was little understood and is still little understood by science and was known to be deadly and thought to be easily spread. In Wales, we were told to expect over 20,000 deaths and to prepare for a demand on our health and social care that had never been seen before. The modelling suggested that we should prepare for the system to be overwhelmed with more than 400 people with acute needs entering hospital every day as a direct result of COVID-19. It was against this backdrop that we in Swansea Bay began to prepare for the surge in COVID-19. One of the things that we didn't know at that stage was how vulnerable care homes for the elderly would be. And there could be no doubt, looking back, that the virus has had a profound impact on the care homes and the residents and staff. 46 people have died as a result of COVID-19 from our care homes across Neath, Talbot, including one member of staff. This has been the pattern across the UK to varying degrees. We're by no means outliers in Neath, Talbot. But the first surge is now past, and across the Swansea Bay region, we wanted to assure ourselves and the public that we'd done what we needed to do and we should have done in terms of our approach to safeguarding care homes, and that we're able to learn any lessons that would help us if and when a second surge emerges. Very early on in the health and social care sphere, we set up an emergency response infrastructure which reported to a gold command group made up of the two directors of social services and the executive director in the health board, and Jack Straw was commissioned to chair that. Many of you will know Jack Straw from his time as the chief executive of Swansea Council. He came in to chair that gold group, as we called it. Reporting to that gold group was a number of other groups, but in particular there was a silver group which looked at the operational detail of our response across the health and social care sector. This Gold Command reported through to the Regional Partnership Board, and it was an extraordinary Regional Partnership Board set up as a result of COVID to deal with COVID as a crisis. And it was this board that commissioned Jack, both in his chairing role, but also then this report on care homes, which you see before you today. So the difference, Chair, between the Regional Partnership Board, the Regional Partnership Board is set up to look at health and social care across the region. In this region, that's Swansea Bay. West Glamorgan is what the region in general is called. So that's not specifically a health and social care region. That is, for want of a better word, what we call our region over and above the health and social care part. But actually, it was the Regional Partnership Board as an extraordinary Regional Partnership Board which did commission Jack's report. And it should be seen as that, Chair. So I don't know if the report has given any confusion around that. It was the Regional Partnership Board that actually commissioned Jack's report. The report, I think, is the first of its kind in Wales to critically look back as a region to our response to COVID-19 in care homes. I think there'll be many more to come, Chair. And clearly there's a real focus on this issue across Welsh Government, but also across the UK and into Europe. So with that scene setting, I think I'll hand over to Jack Straw, Chair, or hand back to you, Chair, to hand over to Jack Straw.
Thank you. Thank you very much for that. I hope we're all clear as to who was scrutinising whom. But however, before I hand over to Jack Straw, on behalf of the committee, I wanted to place on record our total appreciation of all in the care sector, everyone from officer level to the frontline carers. Thank you on behalf of the Social Care, Health and Wellbeing Committee for going the extra mile. However, the report asks us to look at endorsing the report. However, our job is to scrutinise, not just to endorse. So as you can imagine, we have many questions, and I'd like to ask Jack Straw, first of all, to give us his introduction to the report before the questions begin. Thank you.
Thank you, Chairman. Councillor Rob Jones was indicated. I don't know whether you want me to carry on or...
Councillor Jones, do you want to come in at this point?
Yeah, I just wanted to clarify the point you made about the difference between the RPB and the extraordinary RPB.
Yes, please.
As chair of the RPB, everyone will know that when the pandemic actually hit, we went into unprecedented times. There are 3 statutory partners of the RPB, which is the Health Board, Swansea Council and ourselves, and we are commissioned to deliver the statutory services on an individual basis as those statutory authorities. In essence, at the beginning of the pandemic, the Extraordinary Board was brought together with those 3 statutory partners. And in essence, the RPB in general, which is also made up of the third sector, carers representatives, patients representatives, citizens representatives, social landlords, etc., did not take part in the decision-making process because in essence, the normalised RPB was suspended and the extraordinary RPB had to move at pace, and hence the 3 statutory partners were the ones that were actually then making the decisions as we go along with Jack, with the Silver Command team. And it was that board that commissioned then this report that's in front of you today. So I hope that's clarified it a bit further for you.
Thank you very much. As I say, I think we really needed that clarification before we began. Now, if we are ready, actually, I can see Craig Griffiths, our legal officer, indicating. Do you want to come in before Jack Straw, Craig?
My apologies, Chair. There was just a technical issue there and everything's now resolved.
So it was an accidental hand. OK, before I finally welcome Jack Straw to address us, is there anybody else who wishes to say anything before Jack begins his address? No? Excellent. OK, welcome, Mr. Straw. Take it away.
Thank you, Chair. I'll try and keep my introduction brief because, as you indicated, it's probably important to allow the time for questions. But if I can just give an overview of the report rather than trying to take you through the detail of it. I think, as Andrew indicated, the issue of the COVID response and care homes in particular is going to be scrutinised locally, regionally, nationally, UK-wise. So the partnership commissioned this work to establish how well placed we were, if you like, and prepare the evidence base to go into those types of reviews, which no doubt will take place over the next year, 18 months. And in preparing the report, obviously, I worked closely with the directors of social services and the executive director from the Health Board. So although I've authored the report, it is in agreement with those statutory officers, and indeed, for some questions, those statutory officers obviously will be better placed to answer than myself, but I'm sure you're aware of that. It was very important, I think, that we did an honest appraisal, and in so doing, that does allow people to think or interpret things as criticism. And I think we just need to be slightly careful because, as Andrew indicated, hindsight's a wonderful thing. And of course, we've got to judge the decisions made locally, regionally, nationally on the information and evidence that was available at the time the decision was made. So there was a warning in the report, which I'm sure you're all aware of, that we do have to make judgments based on how decisions were made at that time, as opposed to applying hindsight. We have also been, I think, quite brutally honest about both the strengths and the challenges, because you can't learn unless you identify both. But it's important also to remember that behind this report, West Glamorgan Partnership has maintained a comprehensive database of interactions with the care home community across all aspects, whether it be testing or pastoral support or whatever. And that is a massive, almost daily database that covers a lot of the detail that ultimately supports this report. And that level of information obviously is going to be important when future reviews take place. And indeed, you may be aware that Professor John Bolton, on behalf of Welsh Government, is carrying out some review work already, and the partnership statutory directors have obviously contributed to that review, and the information that's before you today, plus more information from that database, is the basis on which we are contributing to that. So I guess the focus was about assurance. You know, the first thing was, has this partnership, can we be assured that we've complied with existing guidance throughout this whole process? And then I guess learning, what have we learned from this, and are we better prepared for second waves or similar events in the future? The status of the report in that sense, just to be clear as well, is that obviously it was commissioned, as you've been told, and it's going to the 3 individual statutory bodies, and it'll be for them to see. Each body will no doubt decide what further work or scrutiny it wants to undertake, and what further evidence or lines of inquiry it wishes to pursue. So it's a starting point, not an end point, I would say. And obviously I'm attending others to assist with that process. I think in overall, the only other point I'd make, which I think is really important and will be tested certainly in the Welsh context, is I think the report does demonstrate very strong partnership working between the 2 authorities and the Health Board, and all of the key issues have been agreed across the parties, and I think that will be important certainly in the Welsh context when those reviews take place. In terms of overall conclusions, I think the report shows that we can be pretty strongly assured in terms of complying with the existing guidance at the point, which is the first test, if you like. There are, as identified in the reports, occasions when guidance was changing so rapidly that there would be small delays between a ministerial announcement and actually something happening on the ground. But I think that was about logistics. It wasn't about failure to comply. So I think we can give, as a partnership, we can give strong assurance that we've complied with guidance as it existed and as we are required to. I think the other thing that can be strongly demonstrated, which I think is important when you think about the responsibilities for the community that we all have, is that there's clear evidence that leadership, whether that be executive leadership or political leadership, has sought to influence national policy and guidance in light of what's happening in communities, and challenge that guidance where appropriate. And there is evidence that on occasion local activity in this region has resulted in updating of guidance, or indeed of implementing changes in how issues were managed. I mean, there are a number of challenging areas, and probably the greatest challenging area across the UK, well, Wales and indeed the region, were the efforts that Andrew's already alluded to, which was the emptying of hospitals in preparation for the tsunami that was anticipated in March, April. And obviously that is where the issue of whether harm has been transferred between sectors, you cannot give a high level of assurance there, because quite clearly where patients were transferred out into care settings, then infection did occur, and that is an issue that's going to have to be addressed nationally. So there are a number of challenging areas, but transfer of infection between sectors is one. I think a health service manager sitting here would say yes, but being in hospital wasn't a safe environment either, and infection has occurred in the hospital settings as well. And I'm sure that's going to be a major feature of the national reviews that go on. I think in terms of, because I'm not, obviously there are sections in the report on testing, ethics, etc., which I'm not going to go into detail now. I'll leave that for questions. But in summary, I think if you think about, are we better prepared for that second wave or similar events in the future, then quite clearly across the system, the capacity creation, whether in NHS and beds or whether in social care, the ability to flex staff, move people around, do things differently. So that creation of capacity and moving it around in terms of what's needed at a particular time is much better honed now than it was in March, and we're a much better place to deal with that type of event in future. The infection control and prevention of infection spread is clearly much better placed now than it was before, because systems, practices and procedures have evolved and developed over the last 3 or 4 months, such that they're pretty robust now, but they evolved over this period. So again, my view, and I think the view of the directors, well, absolutely the view of the directors, is that we are better placed. So, Chair, I'm probably going to shut up at that point, because the report, I think, and it's only my view, I'm an independent person, so my views are only advice. I think this is a report that does need scrutinising, but it also needs reflection, and I think people will come back to elements of this over a period of time. So I will stop there without going into any further detail to allow questions, or indeed if people want me to say more about particular elements, then I'm happy to do so to help in any way I can.
Thank you very much for that. Yes, we did have a pre-briefing meeting yesterday where we looked at some of the areas that we wanted to discuss today, and the first person who indicated he would like to ask a question today is Councillor Woolcock. Councillor Woolcock, are you ready?
Yes, thank you, Chair. Would you? I've got 2 questions. Would you like me to ask them individually or both, and they can answer both?
I think if you look up the infection questions first and then go on to the revised eligibility criteria.
Okay, take them one at a time, yeah? Okay.
Yep.
So the first question then, Chair, is on page 11, and we've been asked to quote the page that we're referring to within the report, and it's on the final paragraph, and it states, and I quote, "We do know that there was infection in the community which may have been transferred into hospitals," end of quote. Well, Chair, we also know that non-COVID patients contracted the virus after being admitted to hospital. Is there any information as to how many people were infected after being admitted to hospital? And as a follow-up on that, and you quite rightly say that we held a pre-briefing meeting yesterday, it was also suggested by Councillor Edwards at that meeting yesterday that I follow up on that by asking the question, and similarly, how many had the virus after being discharged from hospital? And that particular element of the question, Chair, fits in with the UK Public Accounts Committee of yesterday, who published their report, and they stated, and I quote, "It was reckless to discharge patients from hospital to care homes without being tested." So could I just ask that question first of all, and then come back to the second one later?
Thank you.
Sorry, I presume Andrew will be best placed to answer that.
Sorry, Chair, I did have my hand up. I put my hand up to answer. Apologies. Do you want me just to come in to answer these questions?
Yeah, I'm quite happy. Whoever wishes to answer the questions, if you just indicate, then that would be great. Okay, Andrew, take it away.
Yeah, thank you, Chair. So this is an issue which is exercising lots of minds across the UK, as Councillor Woolcock has said, and we don't have figures, and we don't have figures for the very simple reason that at the beginning of this pandemic, we weren't testing people, so we don't know how many people were transferred out of hospital into community who had COVID-19, because we weren't testing at that stage. So that does impact on our figures. Likewise, we don't know how many people going into hospital then caught the disease as a matter of fact of actually being in the hospital. So I'm loath to try and pull together figures which aren't going to be reliable for this committee. So from my point of view, when I looked at this yesterday, and thank you for the pre-knowledge of the questions, we couldn't pull those figures together, and I think it wouldn't be right for us to try and do that. Oh, have I just pressed something, Chair?
Yeah, I've got a problem with my screen. Hang on, what's going on? Oh, I'll just carry on and hope for the best. Councillor Walcott, do you want to come back on that?
No, I mean the lack of testing. If that is the response to the question, Chair, then that is understandable, although regrettable. Really, it's a pity. I mean, you know, the World Health Organization guidance at the start of this pandemic was test, test, test. If that has fallen down, then clearly that's not a local government matter. That is a central government matter that needs to be taken up, and we need to reinforce, I guess. Would you like me to move to the second question?
Yes, if you could, please. Thank you.
Okay, so the second, incidentally, I've lost the screen as well, so I don't know what's happened there. It's somebody's requested control for some reason, but I leave the technical issues sort themselves out, I think. So the question 2 then, Chair, is contained on page 12, and it's the first paragraph, which mentions the revised eligibility criteria for social care. Now, despite the transparency, and I quote transparency, shown by the RPB, the revised eligibility criteria can be considered as being high risk. So what monitoring has subsequently been carried out in respect of the revised criteria, bearing in mind that social care is a statutory requirement? And a comment from me, Chair, is by means of comment, then the clear message must be that social care, whether at care home or community setting, is much more secure in the public sector. Now, that's a message, again, I think that we need to relay to central government, whether that be UK or Welsh government, and join the ever-increasing numbers of individuals, organisations, that are calling for social care to be better funded. So that's the second question, Chair. Thank you.
Thank you. Andrew, do you want to respond to that?
Yes, thank you, Chair. If I start, it may be that the head of adult services wants to come in once I've finished. But I'd want to reassure the committee that we, at all times, we've complied with statute and guidance to the full content that we absolutely could. So we've never moved away from statute. The law did change, Chair, when COVID came in. So there's specific COVID-19 guidance that actually changed as a result of the epidemic, and that did change our ability within adult services to look at cases differently. Now, the eligibility criteria that Councillor Woolcock refers to was a document that set out how we may need to respond should we have any particular surge. So what we were saying quite openly to the RPB and to members was, look, if this gets as bad as we think it's going to get, these are the sort of things which we might need to do. And I think that was right that we did that before we got to that stage, in order to give fair warning both to the public and to you as members, so that you could counter that if necessary. Now, in fact, in Neath Talbot, what we did was we rated all of our adult services cases, green, amber and red, and the green ones were cases where we had negotiated with family that they would then start to provide care and support to their loved ones, not just because we asked them to, but because we were going into a situation where we were locked down and they wanted to be locked down with their loved ones so that they could provide the care at that stage, and they didn't want services going in to expose their loved ones to the risk of COVID-19. So those are the green ones. The amber were where it was heightened risk, we felt, if we withdrew services, and obviously red was actually there's no way that we could withdraw services. Now, I could tell committee that those were our preparations. We never moved to switch off even all of the greens. So we never got to that stage where we had to do that. We were always going to be it was always going to be a proportionate response, and that's what we've done throughout this pandemic. So we've never had to switch off all of the greens. There's been times when it's been close where we've said, look, should we or shouldn't we? We've always stopped doing that because we understand how important the support is to our service users and to the public. So we haven't had to switch off all our greens, but we wanted to make sure in the eligibility criteria that everyone understood that we would be prepared to do that if the demand and the surge came that we were expecting. So I hope that answers the question. I don't know whether Angela wants to come in. I know that Jack's got his hand up.
Angela, do you want to come in? Angela Thomas?
Yes, Chair. I think Andrew's covered it. I mean, just to give some reassurance that we even though these people were on a RAG status, we were in touch with these people daily and weekly, and we still are. So even though we weren't visiting at the time, we were in telephone contact with these people all the time. So, you know, people weren't left out on a limb.
Thank you. Jack Straw, do you want to come in?
Yes, just briefly, Chair. Just to emphasise, I think the point of including this in the report in particular is, whilst Andrew's right that it was never triggered, I think in lessons learned in terms across Wales now, actually being prepared for those events and publishing your preparation, I think is important. Are you with me? That's why it's highlighted, because we may well have whether it's a second surge or a continuation of the first, putting that stuff in the public domain so people can comment, challenge, etc. I think was an important step, despite the fact it wasn't ultimately needed. Sorry to intervene.
Thank you. Anybody else wish to comment on that before I ask my question on this subject? Jack, can you put your hand down for me, please? Right, I'm very glad that this question has come up at the very beginning of this, because I did want to ask about these revised criteria as well. So just to make sure we've understood this correctly, these revised criteria were a proposal that should be used should they be necessary, but they're not actually applying at the moment. I just need to get this absolutely clear. But the creation of these revised criteria, how long do we expect them to remain in existence? And can we have assurances that if the new normal becomes the normal, if that ever happens again, that these criteria will not remain in place, but that we will go back to where we were before? We know it's an emergency situation, but we need to be absolutely clear exactly what's going on. Andrew, can you respond to that possibly?
Yes, thanks, Chair. So, yeah, so it's really important that I say to the committee that, you know, we're not through this crisis yet by any means. We're still in what we're calling an adaptive phase, where we're adapting to the possibility of future surges, whether they be very high surges or super surges or relatively less of a surge. So we're preparing for all of that. And so these things need to be in place. I think what I can say to committee is that if we have to enact any part of those eligibility criteria, that we will let you know. So we will let you know what we've done and when we've done it and for how long that will last. So I'm absolutely prepared to do that to give you reassurance going forward.
Thank you. That is just the reassurance that I think we needed. Councillor Woolcock, are you happy with that before we go on?
Yes, but just quickly then, Chair. So the monitoring, the subsequent monitoring that I mentioned in my question, I think Mrs. Thomas has answered that in as much as she says that the ones in the green are still being contacted regularly.
That's how I understand it. Angela, do you want to come in?
Yeah, that is correct. And actually, we've stepped up to visits as well. So where we've seen some of the reds and the ambers are starting to wobble a little, we've actually got PPE for the social workers, and they're up there making face-to-face visits. So yes, everybody is being seen.
Thank you very much. Okay, I think we're able to move on to our next question now. I can't see any more indications. Councillor Llewellyn, you wanted to talk about the effects on families.
Yes, diolch Cadeirydd. Thanks, Chair, and thanks for all the contributions so far. I think when an independent inquiry is held into the COVID period, the failure to protect our older people and staff members for that matter in care homes will be a major question. And that's true for all four nations in the UK and all four governments. Now, the report before us today on a regional basis tells us something about structures and processes of decision making, but the report doesn't reflect to me the experiences of the residents, families and staff members of care homes. In my conversations with families and staff over past months, they tell me of the tremendous care and commitment that has been shown day in and day out, but also the fear, despair, and in too many cases, the loss that they experience. Can I ask Mr. Straw what the sources of information are in his report that helped him to reach these conclusions, and if any attempts were made to contact those affected or their advocates? And Chair, these voices need to be heard. If they're not included in partnership, health board or regulatory reports, we need to ensure that the opportunity is given through our scrutiny meetings or focus groups or whatever other avenue is available. Thanks, Chair.
Thank you. That's a very interesting question. Mr. Straw, do you want to come back to reply to that?
Yeah, I mean, it's a very interesting and important question. It's not addressed within this report. I have to be absolutely clear. This is very much from, obviously, we've looked at the interactions directly with the care homes providers and the like. We haven't gone down to that personal level that you indicate. I think that is a separate study that you may wish to pick up. Your director may or may not have a closer sight of that, but no, this report isn't addressing that issue.
Thank you for that. Did you want to come in, Andrew?
Yes, thank you. Thank you, Chair, and thanks for the question. So as a part of the infrastructure, as I said, we have a Silver Command Group. The subgroup of that Silver Command Group is the Externally Commissioned Care Group. They are made up of some of our commissioning officers across the region. They are in constant touch with residential homes. So we are aware of, and we have had input from residential providers, and that does impact on the way that we're delivering our services. And so this report, I think, Councillor Llewellyn, wasn't meant to be an overarching report, which included all of the views from care homes, but also from the residents as well. This was, I think, a snapshot in time around, look, we're still in the midst of this crisis, but actually, whilst we've got a small lull, let's see whether there's anything that we could learn as those organisations about the way that we made decisions and the way that we analysed the decisions that we made. I think, Councillor Llewellyn, that the paper that you're talking about is one that's to come and will need to happen at some point, as you say.
Do you want to come back on that, Councillor Llewellyn?
Yes, I mean, thanks for those replies, and I'm glad there's an acknowledgement, that I think there's a responsibility on this to conduct further work then, particularly as I think the leader of the council mentioned fairly early on that what we consider to be the normal representation of service users in the public service boards and so on have had to be suspended during to create the extraordinary partnership board to deal with the immediate crisis. But I think we can't lose sight of the people that we need to involve in our future considerations. So I'm sure that's something we can come back to as part of the scrutiny process. Thanks very much.
Thank you for that. Angela Thomas, did you want to come in?
Yes, just Chair, I'm happy to pull that paper together. I've got numerous examples which I get on a daily basis about care workers going the extra mile and actually sitting with residents until they pass away, and families have been grateful for that. So yeah, I'm happy to pull that paper together.
Thank you very much for that. This leads rather well on to Carolyn Edwards. Councillor Edwards' question. Would you like to ask your question now, Councillor Edwards?
Thank you, Chair. My question, it does follow on from the previous questions, and is pertaining to the general support to care homes on the matrix on page 6 of the report. I'd like to ask a question on pastoral care. I'd like to ask, what lessons have been learned from totally isolating residents and patients from their loved ones? And will there be any changes in the way visiting, management of information and so on given to relatives, and also how funerals may be managed in the future if we do get a second wave? Thank you.
Thank you for that. Who'd like to reply to that?
Andrew.
I'll have a go, Chair, if that's okay.
Thank you.
I'm not sure about. I can comment on funerals. All I can say is that clearly we recognised throughout all of this that that we were balancing risks. So you're balancing a risk of infection against the risk of isolating people who, might well have been end of life, who will have been very worried in a care home, not being able to access their loved ones. So what we've done is we've tried to manage that risk as the best we can, and in terms of the guidance that we've had from Welsh Government. What we do know from care homes is that they've been very innovative in trying to get their residents to have contact with families. So they've used digital computers like Teams and WhatsApp, etc. They've allowed, where they can, families to come and stand outside and have contact. But you're absolutely right. None of that was ideal, and none of it is ideal. I don't know what the lessons that we can learn are. We're not clear at the moment about whether COVID-19 is airborne. So, the use of masks, etc., we're not sure whether that is the answer to protecting. So we wouldn't want people going into care homes if there's any risk that they could transfer the infection into care homes, given what we see when it does get into care homes. I think the lessons that we've learned are there are other ways that we can provide contact. But actually, these are really difficult decisions that we're having to make on a day-to-day basis. And we can only make those decisions based on a balance of risk and the guidance that we're getting from scientists across the world, but certainly across the UK.
Thank you. Councillor Jones, did you want to come in?
Yeah,
Leader?
I was following up from what Andrew said. The majority of the time when we were implementing the severe restrictions, because let's be fair, this is probably the worst medical disaster in the last 100 years that we've had to face. We were guided and instructed by Welsh Government with things like cemeteries and crematoriums. And as Andrew was indicated, the social distancing is still in being, and we've already discussed here that we know COVID was taken into hospitals, we know COVID came out of hospitals, and that is by contact, whether that's from an inanimate object or whether that's physical contact with individuals, which is why our staff, both our social care staff and our health board staff, subsequently contracted COVID. So the dichotomy is, do we have contact and allow contact with the possibility of contagion spreading, or do we restrict contact to try and limit the spread? There's no easy answer to it, and we can only be guided by the science. And we still have the social distancing restrictions, and hence that is law in Wales, which is different to any other of the UK. So we have to comply with those COVID regulations that have been introduced on an emergency basis. And until such time as that guidance change, we are restricted in relation to things like attendance at cemeteries and funerals. And a classic example will be on next Monday, when we have the funeral of Councillor Steffan ap Dafydd, where a well-liked member of the community will not have the respect that he would have been owed, like many other people that have died during this pandemic, and we all mourn the fact that people couldn't pay their respects. Dare I say it, being personal, I still haven't buried my father's ashes when he died at the beginning of the year because of things that have come forward. So there's no easy answer. It is an open question, and dare I say it, if we do get a second wave, we could go back to original lockdown conditions, or if we have a localized or regionalized outbreak, we will then have to take certain measures where in this particular area we would have to implement and go back on the lockdown rules. And only yesterday I actually sent an email via the WLGA asking what the criteria and thresholds would be for local lockdown, regional lockdown that would lead to national lockdowns, because at the moment we haven't got that guidance. and what powers we would have as a local authority to implement and require dealing with these issues on a local basis, and then, you know, who takes over on a regional basis. So, you know, I hope that's given some clarity as to the confusion that surrounds the problems that we face.
Thank you for that. Councillor Edwards, do you want to come back?
No, I thank the answers. Thank you. I'm grateful for the answer. Thank you.
Thank you very much. Councillor Steve Hunt, did you want to ask a question?
Yeah, yes, please, Chair. Thank you for that. With the comments and presentations from Mr. Jack Straw, Mr. Andrew Jarrett, and Council Leader Rob Jones, they probably have, to a certain degree, answered some of the points I was going to raise and ask. But on page 12, I do want to drill down a little bit further. On page 12, paragraph 2, it's in reference to the strength of local partnership. It highlights many partnership working groups and teams from local government and health board there. I say there's probably a lot more that could be added to that list, which is an important tool and part of what we have gone through. However, it has been well documented that the PPE was a failure at the beginning and went through failure to the care homes, whether they be public or private. And so I just wanted to know, Andrew has already mentioned 46 people have died in our care homes and 1 member of staff. I just wanted to ask whether what figure was of infection, whether it be public or private care homes within Neath and Talbot Council. And I wanted to highlight or ask Mr. Jack Straw, when he mentioned hindsight, of course, that's a wonderful thing. Could we have done anything differently from the beginning? Because it was something that caught us cold, and there was a lot of decision making. While you have partnership, within partnership, there's decision makers. And those decision makers are the ones that really need to be held to account. Were decisions that were made the right decisions in their opinions? I'm not trying to create a blame game, but I mean, when it becomes something that how people have lost lives, become infected. And remember this, Chair, it's not just about those who have lost their lives or become infected. It's about the mental health state of what this pandemic have created for the future. There's a lot of people going to continue to suffer through many, many aspects of what has taken place, and certainly was losing their own loved ones. So those were the questions I wanted to clear up, was basically how many were infected, if we have the figures, and are we going to learn lessons from our side, and could the main decision makers made different decisions that would have created a less impact on our communities? Thank you, Chair.
Thank you for that. I've got several indications. I've got Councillor Rob Jones and I've got Jack Straw and Andrew. Okay, Councillor Rob Jones, you indicated first.
Thank you, Chair. Just to clarify a couple of points in relation to comments that Steve made as one of the decision makers making these decisions early on. If I just, first of all, Steve, I can't answer how many people. I leave that to either Jack or Andrew. As far as PPE is concerned, we need to put this into context, and the whole report has to be in context. It's a snapshot in time, as Andrew have said. It's what happened at that time. It was based on the guidelines that we were being issued at that time and being compliant with those guidelines. And as this pandemic moved at such a fast pace, we were making decisions at 9 o'clock in the morning that by 12 o'clock midday, we were having to change because the guidance and the science was changing. So it has to be looked at in that context. I'll be honest with you, the information regarding PPE throughout this pandemic, we came very, very close as a Welsh country to running out. We came within days of running out of sufficient PPE. But let's again put this into context. the current spend or the annual spend on PPE throughout the whole of Wales is around about £10 million, and that's an annual spend. In the first 3 months of this pandemic, this Welsh Government spent £200 million in 3 months trying to provide a PPE. We as a region came together and we used a regional process to purchase and obtain PPE, either through normal channels or independently sought. And we became sufficient within our area. We had the capacity to supplement the care homes and a variety of other areas, undertakers should they require it, etc., with sufficient PPE. I'm proud to say that there is now a factory in the Kenfig Industrial Estate, you may have read about it in the paper, that now has completely changed their manufacturing process and is solely producing PPE, and is the largest manufacturing PPE company now in the UK. It got to the stage that we were so efficient with our PPE that we then started to supply other of the 4 home nations, and in particular Northern Ireland and England. So we got our act together very, very quickly as far as PPE is concerned. As far as decision making, the whole purpose of this overview was to see what we could have done better, because at the time the decisions that we were making were the best decisions on the information and scientific advice that we had at that time, based on an evaluation by our officers that were providing us information as to what they thought was the best information at that time. So I agree with you, this isn't a witch hunt. This isn't something that we should be looking to blame in relation to decision makers, but decision making, could we have done things better? Yes, of course we could. I had the RPB meeting on Tuesday where we could have had better communication with the non-statutory members within that board to try and keep them up to date as best as possible. It was the first RPB meeting we'd had since January. Now, you know, as a council, we've been issuing bulletins, etc., to kind of keep people informed about the progress of what the council was doing in all spheres. And as the extraordinary RPB board, we were doing exactly the same thing. But I can assure you that all the decisions that were taken at the time were the best decisions. Were some of them correct? Hindsight will tell us that perhaps not. But then when the guidance changed, and when the legal advice changed, and when the science changed, we adapted what we were doing to the decision-making process. So I wanted to just, as a decision maker here, cover that off so people are very clear as to what we were facing in relation to making these decisions on the best available advice. I'll stop there because I think perhaps either Andrew or Jack could fill in the other gaps.
Thank you very much for that, Councillor Jones. In fact, you've answered some questions that we were going to ask later anyway, so that's been very helpful. Mr. Straw, you indicated, and then Andrew.
Yeah, I was just going to say, I mean, Councillor Jones has covered some of the points that we made, but just on a specific example, if you take PPE, it is covered in the report. Councillor Jones is right in his outline of what happened. But for example, the test locally is to comply with the then existing guidance, and we certainly did that. And in the case of PPE, we as a region, we bought our own to overcome supply problems, but we also implemented full PPE and full lockdown before the guidance changed to say that that's what we'd done. So there are examples where the partnership like that did things in advance of guidance where it could clearly see there was a problem. I think some of the points that the councillor made in this question are absolutely pertinent to what will be the UK-wide, Welsh-wide review. Now, I'm going to express a personal opinion now with the benefit of hindsight, but surely when that review is done, and this isn't about the local partnership, because the local partnership has complied with the guidance, but we're bound to ask national questions about why TTP wasn't introduced months earlier, why testing, at all stages wasn't in place in a different way. And that's about you. And equally with PPE, why did the guidance have to evolve? Why wasn't our pandemic planning and all that good enough to have that in place. Now, I'm not saying that as a criticism. I'm acknowledging that the councillor's questions are absolutely pertinent to the overall review of this, which takes it beyond the regional, which is, did you comply with the guidance? Yes, we can demonstrate we did. If we were facing a further pandemic, would the country have to look at testing, PPE, TTP, all of those things in a completely different light of this experience? I think my personal view is the answer is yes, obviously, but that's my personal view. It's not the, it's not pertinent to this particular review.
Thank you very much for that. Andrew, did you want to come in?
Yeah, just a couple of points, Chair. So on the point around the guidance and following the guidance and generally about the report, so I think it is a very frank report. We've tried not to use hindsight in that, but actually you'll see in it that there is a very small element of hindsight where we've looked back and we've said, well, actually, should we have gone further than Welsh Government guidance? Should we have foreseen something before the guidance actually came in? So we've even questioned some of that around some of the ethics that we were looking at and we were talking about. So I think that's, that's as frank as we can get as far as opening ourselves up to say, these are the things which we were considering, and should we have considered things earlier? And we did that on the basis that actually we need to learn lessons for the future, because as I say, this pandemic isn't finished, and it's likely that we're going to need to think more about how we manage this into the future. So that was the first thing. The other bit about Councillor Hunt asked about the number of infections in care homes. I'm sure we can get that, or at least we can get a figure. I suppose for me it's about where does that lead us as far as scrutiny is concerned. So on what basis do you want to know that figure? We can provide it for you, but how does it help you understand more what's going on? And if there's an answer to that, and you can, and we can, and as a scrutiny committee, you say, well, that helps us to understand, what proportion of people who had that disease in care homes were dying. If that's helpful to you in scrutiny, then that's fine. But I would guard against setting my officers off to collate lots of different information, which we don't have at the moment, whilst we're still in the midst of some real difficult decisions and difficult things that we're doing. So if there's a reason for the number of infections, and if that's the only request from this committee today, happy to go away and get officers to look at that and to provide those figures. But as we go forward, we do need to have a focus about, well, actually, what is it that we're trying to do?
Right. Can I just say I'm very much inclined to agree with you, Andrew, on that there are lessons that we can learn from what happened, but in some cases, chasing statistics for the sake of it may not be excellent use of officers' time, but we'll see what the committee feels towards the end. Right. Okay, that was Councillor Hunt's question. Yeah, I just wanted to know whether you would like to come back on that. Yes, fire away.
Yeah, can I just firstly thank all three responses and for their frankness and honesty, and hopefully lessons will be learned, as they quite rightly said, going forward in case of a further outbreak. Andrew, the reason I was asking is because predominantly care homes are elderly people, and it was to see how many recovered. So that was why it was important that the statistics and Westminster government, Welsh government, were saying that this coronavirus was pretty much, affecting the elderly more than the young, and we know that the young have also succumbed. But I just wanted to understand if there was quite a large percentage of elderly people who did overcome this virus, which is an important start. That was the only reason. If you feel it's a waste of officers' time, I'm quite happy for you not to carry it out. But that I just want to make it clear why I was asking the question for you to go away. But if in this difficult time, I have no reason or rush to have that figure. But Chair, I thank you for your indulgence, and I thank all the officers and the council leader for answering my questions with honesty. Thank you very much.
Thank you very much for that, Councillor Hunt. Yes, you have a good point. I'm glad you asked. I'm glad you elaborated on your reason for asking for those statistics. Thanks very much. Right, okay, Councillor Freegard, I know you have some interesting questions for us. Take it away.
Well, thank you, Chair. I did have two questions relating to page 5 and page 7. My second question, which was about what factors led us to think that we could safely manage this in the care homes, has really been answered by the leader, and highlighting obviously the disparity between regional and national guidance on that. So that's been answered. So I'd like to ask my other question, which relates to page 5. And I'd like to say that I am reassured by Andrew Jarrett, the Director of Social Services, in going forward, that we are well prepared. However, my question is around health. As it states on page 5, we are in joint partnership, joint ownership, joint responsibility with health. We don't have control of certain things, as Councillor Wilcox mentioned about testing. That lies with health. So everything that we have learnt from this virus going forward, the recommendations, how do we know that that's going to be put into place with health? Who's going to monitor it? Who's going to scrutinise it? Because as you can see this morning, we've got lots of scrutiny on elements which the council are responsible for. However, I would like some more clarity on how we're going to monitor the recommendations and all the capacity for creation, as Jack Straw mentions, with health. How are we going to have that reassurance? Thanks.
Thank you for that. Mr. Jarrett, do you want to reply?
Yes, thank you, Chair. I mean, it's an excellent question. So just as we have scrutiny, Councillor Freegard, Health have their health board. That's happening today. I actually sit on the health board. I can't be there today, obviously, because I'm here. And they will be going through the same process as we are and as Swansea are, as far as scrutinising this report. The other bit about that is that we've had very good partnership working around this. So I think something about, crisis, pulling people together. And we're not going to stop that partnership work. So we're going to continue with the gold meeting. And we will then be able to hold each other to account for what we're doing going forward. So this isn't we'll look back and learn the lessons and then the three organisations will go off separately. This is actually, no, we're going to continue to work together to hold each other to account as we have been doing, but also to work out common solutions, because neither organisation can do this on their own.
Thank you for that. The leader, Councillor Jones, wants to come in.
Yeah, it's to follow on what Andrew was saying, and again, to put this into perspective, as a tripartite partnership, that Swansea Council, us and the Health Board, we were meeting twice a week through this. We have now dropped that down to once a week. But I will say that the partnership relationship that has been formed has certainly been strengthened, and we do hold each other to account in that setup that we had. Tuesday, there was criticism from the voluntary sector the third sector voluntary members of the RPB of their lack of involvement, in the sense that they couldn't develop their strength of partnerships. So that has been taken on board and cognizance given to that going forward. But I can assure members of the committee that the strength that's developed as a result of this will continue. I, as leader, sit there as chair and am open to scrutiny, but also make sure that I scrutinise the other partners, and we play a full part in developing that strategy going forward. So I wanted to give members that reassurance.
Before I come back to you, Councillor Freegard, I've got several other people indicating. Do you want to hear all their replies and then come back?
Yes, please.
Yeah. Okay. I had Jack Straw indicating next. Mr. Straw, you're muted. Are you there?
Apologies. Yeah, apologies.
That's okay.
Sorry. Testing's a really good example to pick up on, actually, because clearly it does sit directly within the NHS remit, and probably 6 months ago, if we'd have been wishing to contribute to the debate on testing, we probably would have had no avenue to do that. As Councillor Jones has indicated, the local arrangements now are such that there'll be a national testing plan issued by Welsh Government. There's then a need to convert that into a local testing plan, and the local authority reps are directly involved now in a testing cell that does that. So the Health Board, whilst it is and has always been that some of those issues would have been difficult to get some influence on, we do now have local partnership arrangements where we have direct input into developing that plan. And that's a major change in partnership working that's taken place directly as a result of this crisis.
Thank you for that. The Chief Executive, Steve Phillips, wants to come in.
Thank you, Chair. I just wanted to make a couple of observations building on what the leader said 2 minutes ago, really. I think the first thing I'd say is that I think the partnership arrangements have worked very well with the Health Board and Swansea Council. And from my perspective, I am absolutely determined to hang on to them. As the leader remarked, there has been some tension in the partnership arrangements. We're not seeking to exclude anyone. But we are in the middle of the biggest public health crisis for a century. We're not out of it yet. And at the end of the day, Andrew is the statutory director, as is his opposite number in Swansea. I am the head of paid service in a statutory sense, as is my opposite number in Swansea. And the leader has the political responsibility, as does his opposite number in Swansea. We can work with the Health Board. We need to be cognizant, I think, of the fact that the Welsh Government, rightly in my view, have, I'm speaking broadly now, structured the response to this pandemic on a Health Board basis. The Test, Trace and Protect service is one example, but there are many others. I think that is the right approach. Some of the other structures, which I won't bore you with my analysis at the moment, that are outside of that geographical footprint have not worked so well. And of course, back in normal times, members of this committee and others have remarked on the fact that you cannot divorce health from social care or vice versa. They are two ends of the same continuum, and if ever we needed reminding of that fact, this pandemic has done it. So I think the arrangements that are in place are the right ones. We're not out of the woods yet. And it's the flip side of Councillor Steve Hunt's comment, really, on accountability. I know there are issues in certain quarters with the extraordinary arrangements, but at the end of the day, if people like me are to be held accountable for decisions, then we need the space to make those decisions. And as the leader, Jack Straw and Andrew have all said, the guidance was changing day by day, hour by hour. And I'm afraid, there comes a point in all this where we're actually in the business of saving lives here. And that has to take priority. And in my opinion, the one thing we will not be forgiven for is failing to learn lessons at every opportunity going forward. That is one of the core purposes of the report that Jack has written. There will be other reports along the lines of the discussion earlier initiated by Councillor Llewellyn, but I think that we need to put the whole of this report and where we are at the moment in that context. Thank you, Chair.
Thank you for those very detailed answers. Councillor Freegard, would you like to come back, or are you happy with what you've heard?
I'm happy with the reassurance that health will be able to obviously implement these recommendations and monitor it and feedback to the board. Thank you.
Right, thank you. Okay, we have Councillor Morgan next, please. Councillor Del Morgan.
Diolch yn fawr, Cadeirydd, thank you. I really would like to start briefly by paying personal tribute to all staff, in particular frontline staff in all the sectors, not only for their hard work and dedication, of course, throughout the pandemic, but they put themselves and their own families at risk. I really do think about that a lot. So can I move on and ask about testing? It was raised just now. Looking at this report, reflecting on the last few months, taking us where we are at the moment, I suppose, and then projecting forward, I want to ask about the testing of staff in particular. Members might like to look at page 7, the last 3 paragraphs. But going forward, I want to ask about the state of play currently. there was a report very recently that something like 27% of drive-in tests were coming back within 24 hours, but all of the others were taking longer. I gather from reading about testing that a similar percentage, about a quarter of tests in general now, are what is being regarded as not entirely reliable. So that gives me a little bit of a concern. Also, I'm speaking generally about the Swansea Bay area. I have heard that some members of staff in care homes have not had their tests back at all, so that when individual members of staff ring up to chase for results, they may have gone missing, or they haven't had results at all back. So you know, starting on that basis, I'm just wondering, is there any chance of the partnership looking at maybe moving to double testing, so that possibly utilising two methods and/or two agencies for testing? I gather that the capacity for testing in Wales is relatively high now, and we're not making use of them all necessarily. So given all of that, I feel personally anyway, that if we can improve the whole thing about testing, both in terms of the speed of the results and the reliability of tests, that will help enormously, you know, going forward. So could I just put that, please, to whoever wants to respond? Thank you very much. Diolch yn fawr, Cadeirydd.
Thank you. Anybody like to reply on that? Andrew, I can see you indicating.
Yeah, thanks very much, Chair. So I haven't been involved in the TTP side of this, but you're absolutely right, Councillor Morgan, that testing in some parts has been problematic. Now it's quite detailed, but if I just say that there's two testing mechanisms, one which is a national testing, and one which is the local testing, which our health board carries out on our behalf. So the local testing has been working fine and is timely, and that has been so for some months. And I'm reassured that when people go through that mechanism, that they will get their results back in a timely way. You're right around the national testing, and that is the testing at the moment that's happening via care homes. So it's self-administered tests, which they send off for, do the paperwork and send back. We are hearing that they're struggling to get their test results back in some cases, and we have relayed that through to Welsh Government as Directors of Social Services. And I know the Health Board have done the same. I think the notion of, I'm not qualified enough to talk about whether we should double test, and whether that would make either the test more reliable, but certainly it would put additional burden, I think, on whichever the process is. And I know that the local process through the Health Board is already under some pressure at the moment on its antibody testing. I think that's as far as I can go, Chair, in answering the question.
Thank you. Are you happy with that, Councillor Morgan?
Thank you, Chair. Just to reiterate then, I take the point about pressure on staff and on systems. But of course, with time, hopefully governments and local partnerships can find ways of of improving methodologies and so on. So I'm just hoping that we can. This is an important area. If we can get testing right, then it'll help everyone going forward. So yeah, I mean, double testing is known right across science, isn't it, to be a fine way of improving the situation. Implementing it is not necessarily going to be straightforward, but on the other hand, I think we really should be looking at this, as a matter of urgency. Thank you, Chair.
Thank you for that. I can see the Chief wants to come in, but I've just had a message from the Assistant Chief Executive to say that there will be a member seminar on Test, Trace and Protect in September, which could be useful. Mr. Phillips, do you want to come in?
Yes, very briefly, Chair. On Councillor Morgan's point really about testing, we shouldn't lose sight of the fact that the testing regime goes well beyond the care home sector and what we're talking about this morning. So, for example, there is a full dialogue going on at the moment between the Health Board and the Directors of Education, designed to ensure that we have what I might loosely describe as mobile testing capacity available for our schools when they reopen in September, in the event of, and we've actually had one or two positive tests in our schools in the 3-week period back in June, July. But I'm very keen that we should do everything possible. This is about learning lessons again and preparing for what we know is going to happen in terms of the reopening of schools in September. And there are other examples I could give as well, which I won't, but members may be assured that in addition to what Andrew has said about improving the regime, which is undoubtedly problematic in certain arenas, we are looking at the totality of the testing regime and its application. Thank you.
Thank you very much for that. Okay, moving on. I did have Councillor Wyndham Griffiths indicating, but he's told me that his question has been answered, so thank you for that. Councillor Goldsworthy, you had a question about the timing between being tested and being declared medically fit for discharge. Can you take it away, please, Councillor Goldsworthy? Are you there, Councillor Goldsworthy? Are you muted?
Yes, no, I told you earlier, it's already answered on page 7.
Brilliant. So you're quite happy, yes? Excellent. Right, well, that's the list of questions that were given to me yesterday in pre-briefing. However, I do have a question myself. There are many references throughout Mr. Straw's report to the principle of not knowingly transfer infection. However, on page 8.3, it took longer than ideal to agree this principle. Now, there are so many references to this, I'd really like to know, can officers expand on this? Was the principle unique to the Extraordinary Regional Partnership Board members? Did it apply to all members? And also, the report quotes that on page 8.4, some clinicians continued to operate on the basis that once an individual was medically fit for discharge, they could be transferred to a care home setting, even if still COVID-19 positive. So the second part of my question is, can we have assurances that if a second surge happens, this problem will have been resolved? Thank you. Anybody wish to respond?
If I could start then, Chair.
Yep.
So not knowingly transmitting infection, particularly into closed settings, was an important principle for us. When we look back on it, we may have been able to move to that quicker, but I do have to say that we were in front of the Welsh Government guidance. So now the guidance is that you wouldn't discharge into a care home somebody who is known to be infectious. That doesn't happen. You have to have a test when you come out of hospital before a residential home can accept you into its beds. So that's now government guidance, but we were ahead of the government guidance in thinking, actually, it doesn't make sense to us as a region for us to move people who have COVID positive into care homes, because we could see what was happening in care homes. We couldn't control the COVID once it was in care homes. It seemed to go through care homes very quickly. And so as directors, we were pressing the health board to get agreement, and this is before the guidance from Welsh Government, that actually we wouldn't knowingly pass infection into care homes. That then expanded to an agreement that we wouldn't knowingly transfer infection out of hospital into community settings, any community service settings. So that went to domiciliary care as well. Again, I think, as a region, we were ahead of the game then. When we look back on it, we think that maybe we could have done that. We could have done that a bit sooner, but we were probably one of the only regions to implement that at the time that we did. It's easy with hindsight to look back and say, yeah, we could have done that differently. We could have done that sooner, but we were making decisions on the evidence and the science at the time. And we had an agreement, I think quite early on, actually, that we wouldn't knowingly transfer infection into care homes. The issue about individual clinicians is the issue which you always have in massive organizations where you've got lots of people making decisions that, one or two might slip through the net. Well, we've now got checks and balances in place to make sure that that can't happen. We had a difficulty, I think it was a couple of weeks ago, where someone was discharged and the test wasn't done in a timely way. Well, we in the care home said, no, absolutely not. That patient's not going to be discharged until they've got an up-to-date test and we know whether they are positive or not. So I think we have got checks and balances in place. It is difficult because it's such a large system that health are running across the hospitals. But I'm more reassured than I ever have been that we wouldn't get to a stage where we have transferred somebody out of hospital who is COVID positive.
Thank you very much for that. We're coming towards the end of the list of prescribed meeting questions that I had given to me yesterday. But I think listening to your last answer, we've absolutely found a nub of something that we are concerned about. And it goes back to Councillor Freeguard's questions earlier. If I check that I've got this right, and we have been at this for nearly 2 hours, so just let me check we've got this absolutely right. We are at the stage now where you are saying that things are so well organised that we would not knowingly discharge somebody with COVID-19 either into a care home or into a domiciliary care situation. It does beg the question that this therefore has to be liaised with health, because that will mean that the COVID-19 positive patients will be remaining in hospital. And I know that the head of adult services has been trying to find, and yourself, a solution to this, which would involve thinking way outside the box. That if it is dangerous, if we assume that it's dangerous for a COVID-19 patient to remain in hospital, if it is dangerous for a COVID-19 positive patient to come out into a care home and out into a domiciliary care situation, is there any sign of any forward thinking taking place, should we have a second surge, of where these poor people should go? Anybody like to give me any thoughts on that?
Well, I can reassure you that absolutely that has been at the forefront of our thinking, Chair. And the sort of things that we're talking about is, cohorting patients into particular COVID positive wards, or even designating, one of the field hospitals. If we hit another surge, designating a field hospital as a COVID positive field hospital, so that you've got all of those who are infected cohorted together. That seems to be the right way forward. The difficulty we've got at the moment is we've got very low COVID-19 positive patients. We do very low numbers, and that in itself creates its own difficulty, I think. But health have created COVID wards, and if we had a surge, then we would have to look to use the field hospitals.
Thank you very much for that. It's just this thinking outside the box. I wanted to make sure, I'm sure it is, I wanted to make sure that it was in fact happening. I've had an indication from Councillor Steve Hunt that he would like to ask a further question. Take it away, Steve.
Yeah, thank you, Chair. Only briefly, in the conclusion on page 13 at the bottom, it mentions a number of areas, notably national health capacity creation, where assurances cannot be given in relationship to the transfer of infection or harm. Could you elaborate a little bit more on that? At what level do we scrutinise? And I'm not suggesting us, I'm suggesting the many groups and organisations that are set up to make sure that at whatever level, if it's back at Westminster, that we have a voice. I just found that a little bit strange. Maybe it's a little bit over my head in the explanations. So if you could just, in layman's terms, just let me know what that actually means. Thank you, Chair.
Thank you. I'm pleased to see Mr. Straw is volunteering to answer that one. Thank you. Mr. Straw, you're muted.
Yeah, sorry. I'm
That's okay.
Failing on the buttons this morning. Yeah, I'll attempt to answer it because it can sound a bit like management gobbledygook, can't it? Okay, we've covered some of this ground. If you go right back to the beginning of this whole thing, Andrew referred to the expected levels of patient numbers and potential deaths, etc., the complete overwhelming of the NHS, etc. At that point, as early in the report is indicated, the whole pressure on the whole NHS social care system was to empty hospital beds. The then existing guidance relied on the fact that it was safe to discharge people, you know, into care settings or wherever. And if they were infected, they could be isolated and all of that sort of stuff. When you look back, that was a huge managerial pressure, not just in Wales or this region, but across the UK. And what we're saying is, because testing wasn't routinely in place, the pressure was to empty hospitals, and inevitably people moved around the system, both coming into hospitals and out of hospitals, who were infected. So I can't sit here, nobody could sit here and say to you that if you look at the process of emptying hospitals in March, April, that we wouldn't have transferred infection around. I think, to be fair, because it's a public meeting, if the Welsh Government or UK Government were here, they would say, but what choice did we have, given that we were expecting 400 patients a day to overwhelm the system? So I think I can't give a concrete answer on that, except to say that's one of the fundamental questions that ultimately will be under review, UK, Welsh Government, regionally. That's what it means. Perhaps the terminology could have been simpler. I hope that's clear, Chair.
Thank you very much indeed for that. Okay, we are coming towards the end of a very long and I hope a very productive meeting. Is there anybody else who'd like to ask any questions who hasn't asked anything yet? No hands up.
Chair, if I could make a mention, please.
Yes, Councillor Harvey.
Yeah, during this period, I was aware that our Hillside Secure Unit, which is like a children's care home, was praised by the Deputy Minister of Health and Social Care, Julie Morgan, and also by the Children's Commissioner, Sally Holland, for the way it was managed during this period. So I think well done to them. I think that's something positive, and there's been so much gloom, during this pandemic. So thank you.
Thank you for that point. Right, okay, we are coming to the end, and hang on, let me just have a look. Yeah, no more questions, nothing coming up in chat, we're okay. So there is no recommendation, we're just asked to note this report, and I think we've certainly done more than just note it. But at the very end of this, and before we conclude this meeting, I just wanted to repeat our thanks as a Social Services Committee to everybody. And I know from personal experience what's been happening on the absolute front line with the carers going in and out of people's homes as well as in care homes, but also the incredible number of hours that officers have been working. And I do hope that senior staff, I'm looking at the head of paid services, keeping an eye on just how hard some of these officers are working. They don't seem to know where the off button is. They're just working all the hours that God sends. So thank you very much indeed. Right, so no recommendation, no urgent items. I'm very grateful to all of you for your questions and for your answers. And we need to sign out of this meeting now and to be prepared to go into the Cabinet meeting that's concluding. Thank you very much, everybody. Thank you to our visitors. Goodbye. Thanks.
Thank you.
Diolch yn fawr.